Surviving a stroke. This is the topic of discussion in today's lecture. You know the term stroke. Okay, this is a severe medical condition. Stroke, this is also known as brain stroke. Okay, means both the terms are used, meanings are same. Okay, if there is a blockage in the brain vessels, means in the blood vessels of the brain. Okay, if there is a blockage, means if there is a problem with the blood flow through the blood vessels of the brain, then the person may suffer from stroke. Okay, two types of strokes are there. One is called ischemic stroke, another one is called hemorrhagic stroke. Okay, so in case of ischemic stroke, if there is a clot in the carotid artery or in any other blood vessels of the brain, then in that case there is a chance of ischemic stroke. And if bleeding occurs, means if ruptures of the blood vessels occur, then in that case bleeding must occur. And if bleeding occurs, then in that case the stroke is known as hemorrhagic stroke. So two types of strokes are there. And you know that this is a severe medical condition, means immediate medical treatment or medical intervention is required. You need to take the patient immediately to the hospital or any healthcare center, whether such cares are taken, where such cares are taken. Okay, so I was talking about surviving a stroke, means what to do. First of all, you have to recognize whether the person is really suffering from stroke or not. All the people cannot understand whether the person is suffering from stroke or not. So for this purpose, one easy technique is there. One acronym is used known as FAST, F-A-S-T, FAST. The first letter F represents face drooping, means the person may feel numbness in one side of his or her face. Okay, you just simply ask the person to smile. If there is a problem with smile, you have to check carefully, you have to observe carefully whether there is a problem with smile or not. If problem exists, that means that person is suffering from stroke. So that was the first letter, F. Next letter is A. A stands for arm. Arm weakness means if the person is suffering from stroke, then one of the arms, two arms are there. So one of the arms, there will be a problem in mobility of the arms. The person may feel very weak in one arm. Okay, so you just simply ask the person to raise both the arms. If one of the arms drifts in the downward direction, in that case you can simply assume, you can simply conclude that. Means you should know that in that case the person is suffering from stroke. So that was the second letter A. Third letter is S. S stands for speech difficulty. So you just give the person a simple, provide a simple sentence to that person. Okay, and if the speech of that person is slurred or hard to understand, in that case there is a chance that the person is suffering from stroke. Last letter is T. Okay, T means time to call emergency services. If any of the previous three symptoms exist, in that case you need to take care of that person immediately. That means you need to visit the doctors, you need to visit the hospital immediately, or any other healthcare centers such as nursing homes are also there. Those are also hospitals, no doubt. Anyway, means immediate medical intervention is required if the person is suffering from stroke. In many cases, for some time you may observe those symptoms, but suddenly those symptoms may disappear. But in that case also, you should the person should be taken care of by the doctors. This transient phenomena may be a warning of a severe stroke. Okay. Anyway, so after taking the patient to the hospital, what doctors do immediately? First of all, they normally take the patient for CT scan. Okay. In CT scan, if the person is suffering from hemorrhagic stroke, in that case, it is easily detected by CT scan. If the person is suffering from hemorrhagic stroke, and in that case, other possibilities may easily be ruled out. Okay, but in case of ischemic stroke, say the person is suffering from ischemic stroke, so in that case, CT scan may not detect that ischemic stroke, especially in the first few hours of the occurrence of stroke. Okay, in that case, CT scan cannot detect. But MRI, this is more detailed imaging technology. MRI means magnetic resonance imaging. Okay, so if MRI is done, means next step is to go for MRI. If MRI is done, then if the person is suffering from ischemic stroke, then that thing also can be found out easily. Then carotid ultrasound procedure is also there. Okay, by using carotid ultrasound, means here sound waves are used to create the images of the inside of the blood vessels. Okay, so by careful observation of those images, doctors can easily conclude, means easily decide whether the patient is suffering from stroke or not. So that is called ultrasound, carotid ultrasound. Next is angiography technique is there. In case of angiography technique, contrast dye is injected in the blood vessels, and after that X-rays are taken. By careful observation, by careful examination of the X-rays, the doctors can recognize the patient's health condition. Okay. Anyway, so these were the all these things were the detection procedure. After detection of the stroke, doctors can start their treatment procedure. Treatment procedures are completely different for ischemic stroke and hemorrhagic stroke. In case of ischemic stroke, blood clots are there. In case of ischemic stroke, so blood dissolving drugs are prescribed, means are administered. Blood dissolving drugs such as tissue plasminogen activator. Okay, but if the patient is suffering from hemorrhagic stroke, in that case, this drug cannot be administered. In case of hemorrhagic stroke, what is the requirement? Means as a treatment procedure, what is the requirement? A requirement is to lower the blood pressure of the brain. Maybe in some cases, surgical procedures are necessary. So in that case, doctors may go for surgery. Some drugs may be prescribed to reduce the blood pressure. Okay. So these are the procedures involved in the treatment of a stroke patient. Again, in case of clots, means if I talk about ischemic stroke, in that case there is a clot. So mechanically, the procedure is known as thrombectomy, means mechanical thrombectomy. Okay, in that case, a catheter is inserted inside the blood vessels. Of course, this is guided, and after reaching to the target position, the catheter can remove, okay, or can remove the clot, or may provide necessary drugs for the treatment. So many procedures are there which doctors may adopt for the treatment of the patient. But first of all, doctor's task is to recognize what kind of stroke the patient is suffering from. Rare cases are there where the patient is suffering from both types of stroke simultaneously. Anyway, after the treatment of stroke, it takes a long time for the patient to recover, and many other procedures are there, such as speech therapy is there, occupational therapy is there, physical therapy is there, and the patient need to change their lifestyle, such as if they are smoker, then immediately they should stop smoking. They should take care of their diet, fruits, vegetables, whole grains, lean proteins. Only these things may be given to that patient, okay, not other things. The patient may need to take of their vascular health and also the body weight. So for that purpose, the patients need to go for physical activities. So many things are there. Means utmost care of the patient should be taken after the treatment. Okay, after the treatment by the doctors, care must be taken of that patient, because there is a chance of next attack. Okay, maybe there is a chance. So you need to manage carefully all the things, and very often means doctors actually must tell you to visit them regularly. Regularly not doesn't mean daily. Okay. Anyway, so this was all about surviving a stroke. Okay. Okay. So this is the end of this video. Thank you for watching this video.